The Agency for Healthcare Research and Quality. Project ECHO, delivering specialty care to the underserved. Project ECHO Director, Dr. Sanjeev Arora speaking.
I think the first issue that we were trying to address is we realized that underserved patients in the United States and all over the world have a very difficult time accessing specialized knowledge. So for example, there are long waits for Medicaid patients and uninsured patients in the United States to see specialists. There are, in other countries, if you're in Africa or in rural India and you are not very affluent, it's almost impossible for you to find specialty care. The second problem, of course, is rurality. Even if you have resources, sometimes you live hundreds of miles away from a city.
Right.
And it's very difficult to see a specialist. So we developed a model so that specialist expertise of a multidisciplinary team of experts could be reflected on any part of the country or the world without the patient having to move. So essentially, we move knowledge instead of moving patients. And of course, as you mentioned, we started with hepatitis C, and it worked in a very simple way. We put a group of experts in the university, and we have about 25 or so rural clinicians. They join all together on an interactive Zoom call that we are using today, and one by one present patients to each other and to us specialists at the university. And as they did those presentations, what we showed was that after attending once a week for a year, they became tremendous experts in giving even a very complex regimen, which was like chemotherapy, to patients.
For more information, visit us at www.ahrq.gov. Presented by the Agency for Healthcare Research and Quality.